So again, there is one more classification in this Mapleson system. It is classified again further into afferent reservoir or efferent reservoir system. So it's nothing but system is called as afferent reservoir system. That means there are two limbs for a circuit. One is afferent limb, one is efferent limb. The afferent limb is which carries the fresh gas to the patient. The efferent limb is which carries expired gas from the patient. So if the reservoir bag is in the afferent limb, it is called as afferent reservoir system. The examples are A, B and C. If the reservoir bag is in the efferent limb, it is called as efferent reservoir system. That is Mapleson D, E and F. So the most important thing we are supposed to know is the afferent reservoir system are good for spontaneous ventilation and efferent reservoir system are good for controlled ventilation. So this is the common or most frequently we have seen this classification of Mapleson system, Mapleson A, B, C, D and E and F. So in Mapleson A, you can see the fresh gas. There are two ends. When you talk about circuit, you always should talk like this is the patient end, this is the machine end. So in Mapleson A, fresh gas flow is near the patient end, the reservoir is in the limb of fresh gas flow, that is afferent reservoir system, and the APL valve is near the patient. There is a corrugated tube in between. Similarly, if you go to efferent reservoir system, it has been changed. You can see the fresh gas is very close to the patient, whether it is Baines or Mapleson D. So the fresh gas will be very close to the patient end. D, E and F, you can see the Mapleson, the fresh gas is very close to the patient. And the APL valve is away from the patient, that is in the machine end along with the reservoir bag. So you can see the reservoir bag is placed in the efferent limb. So it is called as efferent reservoir system. So this is the common pictorial representation of Mapleson system. So this is the picture. This is a system which we made because nowadays Mapleson A circuits are not available. It usually comes in a corrugated tube. This is the Mapleson C circuit which is commonly used for transportation. Mapleson B, that is Baines circuit. Mapleson F circuit. So this is the most important thing which you are supposed to know. For spontaneous respiration, A is better than D. For controlled ventilation, D is better than A. So now we will move on to circuits one by one. This is the pictorial representation of Mapleson A circuit, also called as Magill circuit. You can see here the fresh gas flow is away from the patient, that is in the machine end, and there is a reservoir bag, the corrugated tube, and the APL valve is near the patient end. You can see here APL valve, fresh gas flow is in the machine end. So the corrugated tube should be a length of 110 to 180 centimeters, so that it should accommodate at least one tidal volume of the patient for effective functioning of the circuit. So what is the technique of use for spontaneous ventilation? As we all know, it is most suitable for spontaneous ventilation. You remember one thing, all circuits can be utilized for both spontaneous as well as controlled ventilation. But the most important thing is the preference. It can be used at the expense of fresh gas flow. So the effective function of a circuit, when we talk, that means at low fresh gas flow or at the limited fresh gas supply, it should be able to eliminate the carbon dioxide to the maximum extent. So when you use low fresh gas flow and it can eliminate carbon dioxide effectively, then that mode is good for that circuit. Okay, fine. So for spontaneous respiration, it is good, we all know, and the technique of use is we have to open the APL valve fully and this gas is vented through the valve during expiration. This is the technique. So you can see here, this is the pictorial representation of Mapleson A circuit. You can see the valve is in an open position. So what happens during the inspiration? There is continuous flow of fresh gas from the machine to the patient. So during the first breath, there is no problem. There is some amount of fresh gas is vented out. At the same time, the patient receives only fresh gas. So it is not a problem in the first breath. So what happens in the expiratory phase? Since expiratory is passive, so there will be expiration of gases from the lung. The lung contains dead space gas, which is carbon dioxide free gas, as well as alveolar gas, which is carbon dioxide rich one. Simultaneously, what happens? There is inflow of fresh gas into the circuit from the machine end. Simultaneously, the patient is exhaling the alveolar gas in the patient end. So what happens when there is expiratory pause? It usually does not happen during spontaneous ventilation because we will not be able to titrate the expiratory pause. It is possible only in controlled ventilation. So during this phase, if the fresh gas flow is adequate or equal to minute ventilation, it will push the alveolar gas out of the APL valve, so that in the successive inspiration, the patient will be receiving mostly fresh gas flow as well as dead space gas, which contains less carbon dioxide. Most of the alveolar gas will be eliminated through the APL valve. So this is the most important part we are supposed to understand. If the fresh gas flow is very low, the circuit will be fully filled with dead space gas as well as alveolar gas. So, during successive breath, the patient will be receiving more of alveolar gas. If the fresh gas flow is adequate or equal to minute ventilation of the patient, it will eliminate the alveolar gas. So, the patient will be getting a mixture of fresh gas as well as the dead space gas, which contains very less amount of carbon dioxide.